I'm Dr. Sandeep, General Practitioner. I would like to invite Dr. Kiran Kumar V.S. Nandivada to present his COE lecture in the IRT program on all about PRP therapy.
All about platelet rich plasma. I'm concentrating more on the injection forms of PRP.
Sir, can you please elaborate on the procedure of PRP extraction?
Dr. Sandeep Rama, thank you for asking me to speak about PRP therapy. Yes, it is a evolving method, and this is evolving not now, it's evolving since almost since 1979 or even before that. But in India, like places, it's now getting more popular. So there is always a procedure to follow for any new technique and precautions, and also the variability of how you extract the platelet rich plasma decides on the result you're going to give to the patient. So it's all the more important that we are very careful about reading about it before we start doing PRP injections. You should know what are the ifs and buts, do's and don'ts, precautions, so that ultimately you and the patient are happy. Correct. When you're giving the patient's own platelet rich plasma, after the first soft centrifugation, you have to test the platelet. How many platelets you got? What is this? Is it satisfactory or not? You cannot just blindly go, okay, this much RPM, this many minutes, go, class, finished. No. Time of spin. Is it a soft spin, low RPM, or a hard spin, heavy RPM for more time? And all these things, I'm going to come to it. How do you prepare it? What is the temperature where maximum amount of platelets have been harvested? So to get the optimum result, the end result must be your platelet rich plasma must be a load where you have high platelet count in the plasma which you take, so that the growth factors, ultimately this is the main important, growth factors must be there which will heal the tissue.
Dr. Kiran Kumar Nandivada, what is differential centrifugation?
Differential centrifugation, where you may do the centrifugation in two setups. First setup is part 1 is soft spin. Second is a hard spin. It revolves around more and for more time. There are certain temperatures. There's a time limit. When you follow all these things, and your anticoagulant also makes a difference. When you follow all the precautions, you get the best platelets, so that the platelets release the active form which stimulate the growth factors, tissue growth factors which produce healing of the wounds or the bones. So unless you follow all the steps 1, 2, 3, 4, whatever it is, you would not get a good yield, meaning the results will be variable, which we don't want. We want the best results. Please follow what I'm trying to share with you, not from my own experience, from the literature, worldwide literature, my friends.
Sir, which size needle is supposed to be used for drawing whole blood?
For drawing whole blood from a vein, we have to use a large vein, one, and a large bore needle. Why? If it is a narrow needle, if it's a narrow pipe, the water coming out from a narrow pipe has very slow water that comes out. If the bore of the pipe is more water gushes out. Why should we use a wide bore 22 or 23 gauge needle? Because if it's too small, narrow, the blood takes time, and we may accidentally, inadvertently activate the platelets to release the growth factors. So platelets become unstable and the procedure becomes deficient. Preparation becomes defective. Got it?
Is it mandatory to check baseline platelet counts before making any PRP preparations?
Procedure for taking the platelet rich plasma layer is done in different ways by different authors. This is with anticoagulant. The first spin is with sodium citrate 3.8%, not EDTA. I'll come to it later. Sodium citrate 3.8% is taken, vacutainer, and then you put it here and then spin it, and after the first spin you take out the upper 2/3 of the plasma.
What is the ideal temperature for better PRP extraction?
So when I started researching on what is the temperature, how do we keep it? Is it at room temperature, Suppose it's summer outside, 52 degrees outside. Can I keep the blood in a reservoir, whole blood in a centrifuge and start the differential centrifugation? No. The platelets in the PRP layer are richest when the first spin, it is in two parts. In the first spin, 300 gyrations for 5 minutes at 12 degrees centigrade temperature and 240 gyrations for 8 minutes at 16 degrees temperature. The second spin, second time we put the centrifugation, it is 700 gyrations into 17 minutes time. Why? To slow or lower the loss of platelets into the poor fraction of platelets in the plasma, PPP, poor platelet plasma layer. We don't want the platelets to be lost. So we do it at 700 gyrations for 17 minutes. When you do the first spin, plasma is separated and the RBC settle down. In the plasma, upper 2/3 you have to remove. What are the precautions? You put the whole blood and you centrifuge it. Then what happens? Plasma separates, RBC at the lower end. Okay, that denser, right? Now in the plasma, upper 2/3 you have to take it out. As it contains platelet poor plasma, transfer the rest along with a little RBC into a new test tube without anticoagulant. Put it in there and then spin it with a larger gyrations force, centrifugal force. But here there is a precaution. The platelet rich plasma, what we normally think, more the platelets, more the growth factors. No, the quality of the platelet rich plasma, which we say the so-called PRP, the quality must be more so that more growth factors are presiding inside. And anything above 800 gyrations, revolutions, brings down the quality, viability of the platelets. So you should not be too ambitious. You should have a specific time, specific centrifugal force created and specific temperature. These very, very important things you should follow. And also exceptional aseptic precautions, sterile precautions. Each laboratory must standardize its protocol. Each laboratory. You have to form your own PRP protocol, preparation protocol. Better, that's better. Soft spin, initial part we used 12 degrees. In the later part of the soft spin we used 16 degrees. And why do we use this? To reduce the activation of platelets. The platelets must be activated at the right time. There's no need for early activation so that a lot of coagulation occurs. No, we don't want. We want it only at the end point, that is when we inject, it should happen. For this purpose, we need to have a lower temperature so that activation of platelets is delayed. Some authors use an exogenous activation of the PRP prior to injection by injecting some calcium chloride, thrombin, or causing mechanical trauma. In soft tissues, as collagen is already present, collagen is a natural activator of PRP. Collagen is a natural activator of PRP. So there is no need for an exogenous activation of the PRP injection before giving it. When you give this PRP injection into a tissue, what happens? Once it is activated, the fibrinogen fibrin, the clot, fibrin clot, becomes like a membrane covering up the defect, either in the soft tissue, bone, or elsewhere. That's what its therapeutic purpose and the result that we expect. For this, we should have enough platelets. That's the whole point of it is you should have quality platelets existent in what you give. If the platelets count or the quality of the growth factors in the platelets which you collected or extracted is deficient, how can a suitable layer form, a suitable covering fibrin clot form, then how can you expect a good result?
Sir, what is Ehrenfest classification of the four major kinds of PRP preparations?
Ehrenfest classification enhances your knowledge about the four important types of platelet-rich plasma. Please pause and read. So coming to the conclusion, PRP therapy used in many fields like dental, plastic surgery, orthopedic surgery, In soft tissues, better done under ultrasound guidance. 3 to 4 sessions may be required. Usually, by the first session, if the patient is not having much relief, we have to think about the viability of this procedure. So, patient must be counseled, otherwise, they will be disappointed. A 30 cc venous blood draw will yield 3 to 5 cc of PRP depending on the baseline platelet count. A platelet count in the PRP of 1 million per ml has become the working definition of therapeutic PRP for best results. PRP injections preparation and administration is not new. It's there in vogue in the developed countries since 1979. In India also, it is gaining a lot of importance in multiple fields. Variability of results is disappointing many people, doctors, patients. Should we not pause for a second, check the way the PRP is being prepared? For that, we clinicians must read articles and also see videos. Maybe my video would be helpful. And I invite people who have worked on PRP preparations to pass on their positive suggestions in the comments section so that if there were any mistakes from my side, I will definitely correct them because our videos must be made with responsibility. It is a patient's own blood. We are just processing, preparing, and giving it back to the patient. It is a safe procedure when it is conducted in a very sterile manner. I hope the costs come down in the future so that it becomes a very common procedure. Thank you.
Thank you, Dr. Kiran Kumar Nandivada, for educating us with such an informative session on PRP therapy, its treatment modalities, and how it aids in recovering from injuries.